Hello, my name is Krnacik. I'm a senior economics major in the Clark Honors College, and today I'm presenting my thesis titled The Effects of Abstinence-Only Sexual Education on Teen Health and Behavioral Outcomes. To preface, the federal government began providing funding for abstinence-only sexual education in the 1980s to decrease teen pregnancy and, by extension, poverty. In the last 2 decades, a significant body of research has found that comprehensive sexual education is more effective than abstinence-only sexual education to obtain lower teen birth rates and improve teen physical and mental health. The core difference between the two curriculums is comprehensive sexual education instructs students on proper contraceptive use, while abstinence-only does not. The two main questions the study aims to answer are: 1, do state-level sexual education policies have an effect on teen health and behavioral outcomes? And 2, what is the effect of rejecting federal abstinence-only sexual education funding on contraceptive use, STD, and teen birth rates in the United States? The Title V grant provides a unique research opportunity to investigate these questions. Since rejecting the Title V funding naturally creates a treatment and control group, those that reject and those that do not, and provides an opportunity to investigate the effects that rejecting abstinence-only funding has on teen health and behavioral outcomes. I hypothesize that the rejection of Title V funding would result in an increase in contraceptive use and decreases in STD and teen birth rates. I base this hypothesis off of previous research in this field and the assumption that if states are rejecting abstinence-only grants, they are moving to more comprehensive programs. Transitioning to a curriculum with instruction on contraceptives should increase their use and also result in decreases in STD and teen birth rates. This research utilizes a quasi-experimental difference-in-difference econometric model to estimate the effects of the rejection of Title V funding on the outcome variables in question. The data that this research uses comes from the Centers for Disease Control and the Sexuality, Information, and Education Council of the United States. Difference-in-difference analysis allows economists to estimate the effect of an event by estimating the difference in trends between the treatment and control group following the event being studied. This design is based on one core assumption that the two groups had the same trends prior to treatment, indicating that any change in trends afterwards is a result of the treatment. If the treatment and control groups do not have similar trends prior to treatment, then the regression results will be biased. For this project, the control group is composed of the states that never rejected the Title V grant, and the treatment group is composed of the states that did reject funding after they rejected it. This means that to begin, all states were start out in the control group and entered the treatment group when they reject funding. The maps in the lower left-hand corner of the poster provide a visual representation of states entering the treatment group. The first step of this project was to determine whether or not data for each of my outcome variables had treatment and control groups with similar trends. To do this, I created event studies for all of my outcome variables. These results are displayed in the event study results section of my poster. This exercise allowed me to eliminate datasets that did not have the treatment and control groups with similar trends. 11 datasets qualified for regression analysis based off of their event studies. The regression results for each outcome variable provided estimates for beta in the following equation. Outcome variable equals alpha plus beta times post-rejection indicator plus a disturbance term. Thus, the estimates for beta represent the estimated effect of rejecting Title V funding on the outcome variable. Of the 11 regressions I ran, only 3 were statistically significant. Those were for male responses for condom use, combined male and female responses for overall contraceptive use, and male responses for overall contraceptive use. These estimates reveal slightly less than a 1% increase in condom and contraceptive use following the rejection of Title V. The results indicate that rejection of Title V funding is correlated with small, statistically significant increases in contraceptive use rates and inconclusive changes in STD and teen birth rates. Although the simplicity of my model was helpful in pinpointing the specific effects that the rejection of Title V funding had on teen health and behavioral outcomes, it did not adequately account for the high volume of variables that affect these outcome variables. Due to the large variability in sexual education curriculums across the country, a further study on this topic would need to be scaled down to compare states with similar sexual education curriculums. Despite its inconclusive results, this study highlights the complexity of this topic and the difficulty researchers face on finding causal effects of rejecting federal grants for abstinence-only sexual education on teen health and behavioral outcomes. Thank you.